All right, and it's rolling. All right. Just to make sure I get it right, can I first have you say and spell your name for me, please?
Tiffany Gary-Webb, Tiffany-Gary-Webb.
Okay. And then is that doctor in front of that?
Yes.
It's just making sure. Okay. And then so you're with the uh Black Equity Coalition then, correct?
Yes. So I'm at the University of Pittsburgh, at the Graduate School of Public Health. So it's okay to use that affiliation, but I'm here on behalf of the Black Equity Coalition.
Okay. Um and then talk to me a little bit about this study that we've seen come out talking about vaccine equity. What were some of the things this coalition found in regards to the vaccine equity in Allegheny County?
Do you want me to start with that, Fred?
Yeah.
So we have been, even prior to the vaccination distribution, we've been working for about 57 weeks to look at equitable response for COVID-19 in Allegheny County, particularly for Black communities. We've been, tracking data daily on cases and hospitalizations and death, and trying to work on data infrastructure. So this particular report is coming out of the data working group of our coalition, and it's focused on data processes related to vaccine distribution, understanding the disparities in the distribution so far, and making recommendations on what we can do moving forward.
Dr. Gary, I think I might have lost you there.
Uh-oh.
You froze.
Can you hear me?
Okay.
Yeah, we can hear you now. The last thing you said froze up. The last sentence.
So that we're trying to look at data accuracy, transparency, looking at the vaccine disparities in the county and tracking that data, and then also making recommendations. So not only on data infrastructure issues, but on how we can use data to understand where to distribute the vaccine in an equitable way.
First, looking at some of the disparities, if I was looking at the report correctly, it looks like right now, when you break it down by populations, the white population, they're getting more access to the vaccine than is represented by the population, whereas people of color, they represent more of the population than they're having access to it, the vaccine, if I read that correct.
Yeah, absolutely. And there's a couple different reasons for that. One is based on age. So the age criteria in phase one initially was age 75 and older, and then reduced to age 65 and older. So we know that there are fewer Black people that represent those age categories. So that's one issue. We also know that many of the Black populations have some of the pre-existing conditions that put them at higher risk for COVID. And so the criteria was opened up to include younger people with high risk conditions. However, the county, Allegheny County, did not open up for those high risk conditions until last week. So that's another reason. And then one other thing that I'll point to is the sites of distribution for the vaccine. So we, the pods that were set up by Allegheny County and even some of the health plans were in the outskirts of the city and so forth. And so it's taking community efforts, advocacy by the BEC and other community groups to do community-based clinics, vaccine clinics in certain communities. So we should see those numbers increase after all of those efforts. But especially early on in the rollout, those efforts weren't there.
Gotcha. Because now we're starting to see some of those clinics more in specific neighborhoods. Those numbers should increase. But from what you're saying with this study is up until now, we really haven't had that type of access. It's kind of been more, you had to travel or take multiple buses to try to get to these.
Exactly. In the last couple of weeks or the last month or so, there have been community clinics that are, aimed at specific neighborhoods, and some through the faith-based community. So there's been several of those events over the past couple of weeks.
I would say, Chris, that about 56, 55 weeks ago, the BEC put together a comprehensive plan to address this very issue by looking forward and assessing how we optimize existing resources in the sector, such as FQACs, Federal Qualified Health Centers, how we collaborate with existing nonprofits that may be specific to a particular community, and how we create a coordinated response to mitigate and flatten the curve based upon pre-existing conditions, which has always been the impetus. We saw COVID as the tip of the spear of an ongoing set of issues that predate COVID that needed to be addressed in this comprehensive way, given the impact of COVID and the disproportionate deaths associated with this work. When we first started, Blacks were suffering from COVID and dying at 1.5 times our white counterparts, and we reached as high as 3.0 in the last several months. And so it's doubled. And so our concern is, can we better optimize the existing resources we have, given that this is not an event, it's a process? And how could the optimization of the BEC's network prove to be a valuable partner long-term, given what we see as the current outputs? And we do know that there's a portion of the community that's hesitant, that's vaccine hesitant. And so we believe that there is a required framework that looks at two narratives: those who want to take the vaccine, getting them queued up, and those who don't, how do we maintain the integrity of them practicing the 3 Ws, wear a mask, wash your hands, watch your distancing? And so we've put together profiles, educational guides, videos to support this work. But Chris, we would tell you that none of this is critical. None of this works if you don't have strong relationships. And so one of the challenges we've been trying to really get people to understand is some of the planning that's being executed is planning that's based upon a middle-class value system where you have access to transportation, you can get in a car, go here, do this. And although people are aware of the challenges in other communities, having a secondary response to those challenges are also increasing exposure rates by not being proactive with addressing what we know are disparities based upon race, ethnicity, and social economic strata. And so we just simply want to, as a group of committed stakeholders, create a process that works in conjunction with the county, the city, and other entities to really have a comprehensive response. As such, over 50 weeks ago, we pitched this idea to Dr. Levine at that time, who was the head of the Secretary of Department of Health for the state of Pennsylvania. That relationship led to a monthly meeting with her to really think through and co-create responses that not only addressed Allegheny County, but could be used across the state as a comprehensive response to deal with the disparities that are occurring across the state. And so we're very much aware of the place-based approach that is being implemented today, but we have a much broader agenda, which is to how can we share the just practices and learnings that we've ascertained as a way to inform other parts of the state, ways that we found to mitigate and flatten curves as part of a community response and not just a reaction to COVID.
So to make sure I'm kind of getting this all straight, in addition to obviously everything going on with COVID, there's things you guys are trying to look at to help healthcare inequity then for communities across not only our region, but everywhere for that matter.
Yes, that's exactly right. And we want to do that by optimizing existing resources, not creating new resources, but create more alignment, collaborations, more coordination. Because that's what we're seeing now, Chris. We are an entity that, my name is Fred Brown. I'm from the Forbes Funds, FREDBROWN, Forbes Funds in Allegheny County, intermediary foundation. And so our enrollment was, how can we leverage our network to help address this issue? And so what we keep trying to push is, if there's going to be any investment made it should be investments made into pre-existing organizations that resource strengthens their ability to not only deal with COVID, but to deal with the other underlying issues that create a disproportionate impact on people of color. And so we just want to underscore that, if you can, in your report, that we are not just interested in COVID. COVID has revealed that there's an iceberg, which we all knew about, but now it is exposed it in such a way that it's you can't ignore it. Given that, we want to help people understand that there needs to be a comprehensive response to this that doesn't just encompass getting us vaccines, because that's not going to change the post-COVID issues that will continue to spiral out of control, as we're starting to see people who have COVID are having these secondary impacts on their lungs and their health and well-being. And so we need to get in front of that. And if we can mitigate and reduce the amount of people getting sick, we think that that's a cost saving to the entire sector, the healthcare sector, jobs, people not being able to return to work. We're trying to think, like, if we don't address this now, the cost and burden is going to be greater down the road. And so please help us resource stopping it now, because there's going to be an undue burden on the entire system if we don't address this now.
So
many of us, even prior to COVID, had been working on, equitable responses to healthcare in communities and so forth. And what has been very different in this COVID era is the multi-sector partnerships that have developed. Because those of us who work in the health sector, we know that a lot of these problems can't be solved just in the health sector. They need to be solved in based on other social services and so forth. And so that has been a wonderful part of this coalition, is that we're bringing together so many different sectors to think about the issue broadly, so that it doesn't just remain in healthcare, in the business community and so forth.
So COVID's really just shedding a light on issues that have obviously already been there. And what you guys want to do is obviously, solve the problem at hand now with COVID, but there's problems that once this is done, they still need to be addressed. This isn't something that once COVID's done, we can just move on, pretend everything's great.
Exactly. And we had to urgently come together for, the urgent issues of COVID. And so, especially in the beginning of our work, we were very reactive. We had to react to the data or lack of data that was coming out. We had to, react to the devastating impact. Now we have an opportunity to think forward and think proactively on how we can address some of these issues beyond COVID.
And Chris, I would also say, I'm unaware of, in my 39 years of doing this work, of a group of stakeholders that represent a cross sector of doctors, epidemiologists, epigeneticists, bioethicists, researchers, community stakeholders, and foundation leaders who have ever come together like this for over 57 weeks to work tirelessly to try to provide not just a reaction to COVID, but think more comprehensively about a proactive response. The cross-sectoral learning that has taken place in my professional experience has never been seen like this. And I just want to underscore that you had professionals who gave up a lot of time and resources to do this work, to save, to be a contribution to humanity. I just can't underscore that enough. Like, people were not getting paid to do this. They were volunteering. And the resources we've raised thus far has really been the operations. Like, how do you keep this going? Nobody's getting a fat paycheck. Nobody's like crying for money, or I shouldn't say crying, requesting resources. People are saying, if we get resources, let's do this program. Let's do this program. So I think this is the first time I've ever been a part of something where, even in our effort to fundraise, people aren't crawling over each other to get to the money. They're really like, how does this resource help mitigate this, and can we build that? Our ultimate goal is to build a BEC research lab so that we crystallize these learnings and we share them repeatedly as a space where new ideas are being vetted, and the outputs of those ideas are being used to share with how you flatten and address not just COVID, but hypertension, diabetes, obesity, and the other contributory factors that create the disproportionate impact on people of color. And that's why this is so much more than just COVID.
Yeah, I mean, and getting back to the actual report, the data that we are putting out and the lens that we're putting on the data is also, a very unique contribution, because we are able to, from our perspectives and our expertise, look at the data in ways that some of the officials may not be thinking about. So for example, our analysis of the essential workers. So that has been a narrative throughout the pandemic about essential workers. But what we were able to do is look at, okay, healthcare workers. Healthcare workers are actually a broad sector, and there are many Black workers in that healthcare setting. So if you think about it from that perspective and the numbers that we show, so particularly in nursing homes and hospitals, there are a lot of Black workers, we should have seen more of an equitable distribution of COVID vaccine earlier, since the healthcare sector was actually prioritized. So we're able to think about these problems in a different way from our perspective and really contribute recommendations that may not be considered.
And what are some of those recommendations as we move forward with vaccinations? And then once we get past all this, what are the recommendations you're looking to see from leaders in our area with making sure there is equity with not only the vaccine, but healthcare as a whole?
Yes, so I'll start with the report and then I'll let Fred talk a little bit about BEC as a whole. With the report, that was focused on data issues. And so one of the biggest things that we want right now is to be able to understand the vaccine distribution by race, which we have access to in some form, and by geography, so that we can actually understand where people who have been vaccinated live. And then we can actually better, aim at neighborhoods that don't have a large percentage of people vaccinated. So we are requesting that data from the state Department of Health. And so that's a major recommendation. The other recommendations really speak to infrastructure. We know that even, based on the whole pandemic, that our public health data infrastructure was not as strong as it could be. And so all the way we have been making recommendations, but really trying to think ahead about how we can coordinate, some of the systems and how they can talk to one another, how we can, get people to make sure that they're reporting data on race, the providers and the labs and so forth. So, there is a lot of, infrastructure type things that we recommend. And then one overall BEC recommendation is to have an advisory council that focuses on equity in the county. And one where, there's broad expertise at the table, but that expertise is actually used, and that there is a collaboration with groups such as ours to really be at the decision-making table and think about some of the resource distribution and decisions that are being made.
I would only add that I would agree 100% with Dr. Gary-Webb's assessment. The thing I would add that we would like to see as an outcome is to strengthen our relationship and collaboration with the county and the state, so that this is not treated like, let's hurry up and get vaccines into people's hands and done, but like, let's take a real earnest look at the problem at this moment in time, because we need to, and what is the sustained partnerships that are required, and walk us through whatever people need to establish that, so that we can address this as a systemic response and not a peripheral response. And we need to be clear that this needs to be resourced and supported in such a way that we're not spending a lot of time looking for resources, but spending more time building the necessary relationships to create a hub and spoke model, which is what we presented 55 weeks ago. We believe that if you optimize and build up the FQA season, resilient communities and targeted communities, and you link them to nonprofits as a secondary support system, for example, in the east end of Pittsburgh, 76% of the households are headed by single women with children. If those mothers get sick, what kind of burden does that place on DHS to have to deal with a kid? School, what does that burden put on PPS? And so if we create a way to create a safety net to keep that family intact while mother's isolated or quarantined or what have you, how does that safeguard the family being intact while mom is recovering? And so we know that we can better support the system through a proactive response versus reacting to the issues. And I think the team that Dr. Gary-Webb and others lead has really given us a leg up on having predictive analytics around where hotspots are and how we can attend to those. We feel like if resourced, we could have helped really mitigate a lot of the stuff we're dealing with now by education and constantly engaging people. What's happening now is people are getting a shot and it's being treated transactionally. Get the shot, go about your life. Well, there's far more education that's required after you get the shot. You know, you're not totally immune, and there's a second variant coming out, and you need to be conscientious of who you go around and things like that. But if nobody is educating the community, and the biggest thing that's being promoted is getting a shot, then you're going to continue to see rises because people have a false sense of security that I got this shot and I'm okay. And, you know, so we think there's a need for a much more grounded and comprehensive response that will flatten the curve and save lives and also address these comorbidity issues. That's what the BEC is committed to and would really like for people to see and hear that.
All right. We talked about a lot there. So the biggest things are really, this report talks about issues with the vaccine not getting into the communities it needs to, data not being available, and recommendations for that. But this is really just a microcosm of a greater issue we're seeing across our area in regards to healthcare. This is really just brought to light the issues you guys have been wanting to see fixed, and this COVID has now just been the spark to try to be like, all right, well, here's what we're dealing with. We need to fix this, but we need to fix this for more than just COVID.
Correct.
All right. I thank you both very much for your time. Thank you. I really do appreciate it. We're gonna start putting this together now, and it'll be on a little bit later.
Okay,
Okay,
thank
great.
you.
Appreciate it.
day.
Thank you.